Dr. Euland, board certified orthopedic surgeon, owner operator of OKC Orthopedics and Sports Medicine. And we're back to resume our conversations about total joint arthroplasties. Today we're going to talk about total hips. And there are approximately 500,000 total hip arthroplasties performed in the United States each year. Typically the diagnosis for that procedure is either osteoarthritis, rheumatoid arthritis, or osteonecrosis of the hip. Now, like most things in medicine, things have changed with total hips. When I was a resident, the most popular approach to the total hip replacement was what we call the southern approach or the posterior approach. And most of those procedures were cemented in place. At that time, there was a trend leading away from the southern or posterior approach due to a perceived higher rate of dislocation, and also a trend away from cementing the arthroplasty stem and going to a press fit approach due to cardiovascular side effects, intraoperative cardiovascular side effects. I was trained in what we call the Harding approach or the anterior lateral approach, and that is still my choice today. In that time frame, many incision approaches, 2 incision approaches, and most recently the anterior approach have gained popularity. And oddly, the southern or posterior approach is now coming back into favor. So not unlike clothing styles, evidently surgical approaches tend to come back in vogue as well. And also, curiously, the cemented approach is making a comeback as well. Again, I still prefer a press fit anterior lateral modified Harding approach. That works best in my hands. A recent large meta-analysis has proven that there is in fact no greater dislocation risk with the posterior approach. And in fact, there was no statistical difference